We're here to talk about carotid surgery or possibly carotid stenting. And the reason that we're talking about this is because it's been recommended for you to have your carotid artery repaired. First, I want to explain the difference between artery and veins. The blue are veins, which are blood that's returning to the heart, and the red are arteries, which is blood oxygenated that's going away from the heart. And if you look, the carotid artery is noted is in the neck, and these are the blood vessels that are feeding the brain. At the jaw level, they'll split, one to the face and one to the brain. So here we are in my diagram, the heart, the aorta, and the carotid artery that comes off. It splits at the level of the jaw, one to the face and one to the brain. And it's usually right where it splits is where the disease will form. If we look at this diagram blown up, here's the split, this is to the face and this is to the brain. This would be representing the plaque. Okay? Now, as blood is coming up from the heart, it may form a little piece of clot or chip off a piece of the plaque, which will then go up onto the brain and cause a stroke. And that is exactly what we need to prevent. There are two ways that we can repair this. The first way is going to be surgery, where I'll actually take the blood vessel, and here's your plaque. I will make an incision and open up the vessel like this so I can see directly into the vessel. I will then clean the plaque out and remove the plaque in its entirety. And afterwards, once it's done, the plaque is completely cleared. All right, so there's no plaque. So now you just have this vessel that's open. And what I do from there is I'll patch it and suture the patch onto the blood vessel like so, making the vessel clean and wider. All right, that's the first possibility. The other possibility is that instead of taking the plaque out, depending on, again, at the person, not everyone's a candidate for surgery, but not everyone's a candidate for stenting. Second option is possibly going in from the base of the neck, which is typically about right here, and entering right at the base of the carotid artery, delivering a wire through the plaque and putting a stent so that the stent will just then push the plaque to the side, so it'll kind of look like this when you're done. The plaque will be smashed up against the wall, and then there will be a stent put on the inside to keep the vessel open. That would be the second type of repair. And again, not everyone's a candidate for the stent, and not everyone's a candidate for surgery. It depends on who you are, is how we determine it. And the last thing that I want to really discuss with you are the risks associated with both. These are things that you have to know ahead of time. All right? Stroke. During the procedures, anywhere from 1% to 3%. In the best hands, people who do this a lot, that's usually about the risk factors. Heart attack. And how do we minimize this? Is that we usually have you see your cardiologist, and they will optimize your heart condition so that you can have the procedure. Bleeding, in any type of surgery, you're going to have the possibility of bleeding and infection. These are 4 possibilities. Other normal things that could happen: puffiness. Any surgery, you're going to get some puffiness. Along the incision line, you'll be numb. Men tend to complain about being numb along the jawline because that's where they shave. Women tend to complain about numbness on the earlobe because of the earring. Other than that, these are the 4 risk factors that you have to really know about. And if you have any questions, please ask.